Osteoporosis is something that all of our patients need to be aware of. This is very common. 10 million Americans have been diagnosed with osteoporosis, and it essentially means that patients have thinning of their bones, and it makes it more likely for patients to develop fractures. One of the biggest risk factors in the context of inflammatory arthritis is going to be steroid use and exposure. And that means being on steroids, but also how long and how high a dose. So a lot of what we can do to modify this risk, and this is on the physician's side, but also on the patient side, is we really want to avoid steroids as much as we can and to reduce dosing of steroids if you're on them as soon as we can, because we know that even small amounts of steroids, as low as 5 milligrams or less, over a period of years will inevitably cause thinning of the bones. Things to think about to also help minimize your risk, making sure that your vitamin D level is good. And this often requires patients taking supplements, and then sometimes patients may need medication. So once you're diagnosed with osteoporosis, there are medications to help reduce the risk of fractures. Physical activity, exercise is going to be very important for patients with osteoporosis. And this is also important to help prevent falls. So a lot of the complications in osteoporosis come related to fractures. And a lot of what we can do is try to minimize your risk of falls, and exercise and strength training are an important component of that.